Hi everyone. Now let us discuss MCQ of child health nursing. Yesterday we discussed almost important MCQ from the subject. Now let's see remaining MCQ of it. So here you can see the first question. Normal finding of newborn. Baby girl, especially baby girl. Passage of meconium within 24 hours considered as a normal finding of newborn. Then meconium. What is meant by meconium? Newborn first look called meconium or the first stool produced by newborn. The first stool produced by the newborn called meconium. And typically it passed within 24 to 48 hours. And do you know 90% babies void within 24 hours. 99% babies void within 48 hours of birth. Remember this one. 90% babies void in 24 hours and 99% babies void within 48 hours of birth. Okay. Then see the next question. Within first 24 hours, most of the newborns pass urine. Within first 24 hours, most of the newborn pass urine. The next one, Apgar. Apgar, already we discussed. Apgar is a quick method used to assess the physical condition of newborn, and it done shortly after birth. And it evaluates 5 factors: appearance, pulse, grimace, activity, respiration. Then next question. What are the activities involved when cleaning airway of newborn? What are the activities involved when cleaning airway of the newborn? First one, positioning the baby with head low, gentle suction to remove mucus, tapping the chest. These are the activities involved when cleaning the airway of the newborn, but it not involve resuscitation. Remember, it not involve resuscitation. So these are the activities involved when cleaning the airway of the newborn. Resuscitation required when Apgar score below 4. Resuscitation required when Apgar score below 4, but it not required during simply airway clearance. Remember, resuscitation required when Apgar score below 4, but it is not required during airway clearance of newborn. These 3 factors required when clearing the airway of newborn. The next question, umbilical cord dry at. Umbilical cord dry at 5th day and start to fall 7th day. Umbilical cord dry at 5th day and start to fall 7th day. In aseptic gangrenous process. Then next question, important need for the newborn at birth. Important need for the newborn at birth are: first one, have to clear the child airway and maintain the temperature. So these 2 factors are very, very important needs to this newborn. The purpose of cleaning airway is to prevent asphyxia, and the purpose of maintaining temperature is to prevent the hypothermia. So these 2 factors are very important after birth. The next one, what is meant by roaming in? What is meant by roaming in? The practice of keeping mother and child together immediately after birth is called roaming in. And the purpose of roaming in, to develop emotional development. For developing emotional development between newborn and mother, we practice this roaming in method. The practice of keeping mother and child together immediately after birth is called roaming in. Okay, the next question, newborn should always be kept close to the mother for effective. Newborn should always kept close to the mother for effective bonding. So what is meant by mother-infant bonding? What is meant by mother-infant bonding means it is emotional and physical assessment or development. It is emotional and physical development between infant and mother, and it starts in the first hour after normal delivery of the baby. It should start first hour after normal delivery of the baby, and the purpose of this mother infant bonding is to develop emotional bond and physical bond. Then, so this mother infant bond also called mother infant attachment. Okay. The next question: if a newborn baby doesn't breathe immediately, if newborn baby doesn't breathe immediately after birth, and then flick baby flick baby's sole of foot. If baby doesn't breathe immediately after birth, as a nurse or as a medical practitioner, we have to flick baby's sole of foot, not on the palm of hand and not on the toes. So the position is have to flick on the sole of the foot. Give tactile stimulation by flicking the soles of feet, or also follow slapping or rubbing the infant's back. Slapping or rubbing the infant's back to stimulate breathing. So this is the first one. First preference you have to give. Then next, you can also slap or rub the infant back to stimulate the breathing. Thank you. In the next class, we see remaining questions. And don't forget to subscribe my channel. Thank you.